Welcome, everybody. Thank you for joining us, learning about the ins and outs of the MAHC adoption, at least with Jefferson County Public Health. Today we have Mitch Brown, who is the Environmental Health Services Supervisor with Jefferson County Public Health. He manages on-site wastewater pool, air quality, and land use and healthy homes programs. He graduated with a BS in Environmental Health from Colorado State University and his master's in public health from the University of Florida. He has experience working for various agencies and companies such as Larimer County Department of Health and Environment and URS Corporation, Clear Creek County Public Health and Environmental Health, and Jefferson County Public Health. Welcome, Mitch, and he will tell you all about Jefferson County's roadmap to adoption of the MAHC.
Thank you so much. Appreciate that. And so welcome. Good morning, everybody. Thank you for joining us today. And so just want to say my presentation today is strategies, tactics, and implementation. So yeah, there's kind of the ins and outs of adopting the MAHC. And so it's been a long process for us. And talking with Dr. Beach a little while ago, earlier this year. And so been kind of going around, making the rounds on this presentation, hoping that we can inspire other people to adopt the MAHC, or at least consider adopting the MAHC for those that have pool programs. So with that, I would like to just start and say, let's see. Here we go, a little bit of background. So this is Colorado, or a map of Colorado and the different counties. And the way that Colorado is set up, we do have one state health department. And then back in, I believe, 2018, there was state statutes that required every county to have a public health department. Now, with the public health departments, the services they provide is going to vary. And so you've got some of your more populated counties will have the larger health departments and have more services. And then once you get out to the more remote areas of our state, you're going to have smaller amounts of services. So what that does is it creates an interesting mix of the different variations of health department services across the state. So like I said, we have about 64 counties. We have about 53 plus or minus what we call local public health agencies. Some counties will join together and become one health department as a regional. But after 2020, we saw a lot of those starting to break up because of the political ideology differences. And so it's been shifting a lot. The other thing that makes it kind of fun, and where this kind of plays in a little bit later, is that not all counties have a pool program. So at the state level, it's a voluntary program for the health departments to take on. And so with that, again, those more remote counties that don't have a lot of staff, they may not have a program. Some counties like Jefferson County, we do have a program. We do plan reviews, we respond to complaints, and we conduct routine inspections. So we're kind of the other end of the spectrum. And then you've got everybody else kind of in between. Some people just do complaints, some people just do plan reviews. I'd like to kind of shift and just kind of share the story. So this was our old car. It was a 1999 Honda Accord. And it was actually my wife's car. Her family, they got it brand new, and she drove it through high school, through college, through optometry school. We brought home our two kids in this car, and so a lot of good memories for us. And it ran really well. It was a reliable car, but the thing is, it was old. It had, I think, about 280,000 miles when we got rid of it a couple of years ago. And so things were just falling apart on it, like the temperature control knobs and stuff like that were breaking off, falling apart. You can see on here there's a little bit of hail damage. The paint just the clear coat had rubbed off. Got a few accidents to it, so just a lot of dings to it. My favorite was, though, as time to kind of get old, is, well, first off, to maintain the car became more money than it is to keep the car. But I was driving one day, and the dome light console just fell, kind of like the oxygen mask on it, and so yeah, it was an old car, basically, what I'm trying to go with that. But it was reliable, got us from point A to point B. I drove it everywhere. And like I said, when we had this huge hailstorm in Colorado several years ago that did a ton of damage, this was the car that was out and got damaged, but didn't really care too much. Now, I look at it, I don't have an Escalade. Let's just put that as a disclaimer. But there's cars out there that are like this Escalade, and they've got these little features to them that's like the lane assist that keeps you in the lane when you start drifting. It's got the collision detection. Some of them have Wi-Fi in them even. It's got the adaptive cruise control, and then the blind side or the blind spot monitoring, and then lots of cameras, front cameras, backup cameras, and everything. So where I start with the story is our current pool regulations is a lot like my old car. They still work, yes. Are they the newest, best version of regs out there? No. So in a way that they kind of work. Now we have the Model Aquatic Health Code out there, which I'm calling the cattle MAC for this example here. The Escalade, you've got all these features, and you've got all these it's updated and pertinent to, I guess, what the industry standards, I guess, are moving towards. So the Model Aquatic Health Code, it is based on CDC guidance. So there is some collaboration there. It is science-based, just kind of like, if you will, the Cadillac here. A lot of these little safety features that are on here, they're based off of, where were areas of accidents happening and trying to make those features built into these cars so that you don't have these accidents, right? It is a model code, so it is not it's not a regulatory code, and so it does need a little bit of wordsmithing, my understanding. At least that's what we're being told in Colorado. But it's a great framework. It gets us what we need and what we're trying to accomplish. When we look at some of the differences between the Colorado pool regulations and the Model Aquatic Health Code, it's a great document for us, great guidance. And like I said, it is voluntary guidance. It is based on science. It's based on best practices. It's up to date with the industry standards and whatnot. There are about 14 topic areas of the Model Aquatic Health Code, and so my understanding is a lot of it you can kind of pick and choose. I understand that's what a lot of other jurisdictions have done. They haven't adopted the Model Aquatic Health Code in full, but there are areas that are pertinent to them, and that's what they've chosen to adopt. And then the one nice thing is it's reviewed and updated, and I believe it's about every 3 years, and that's done with the council for the Model Aquatic Health Code. And so that is including peer review, it's including industry input, and then science-based input as well, to keep the regulation, or the code, I should say, updated and relevant. So like I said, the Colorado pool statutes and regulations are currently really outdated. We get our authority, it's established in statute, which was established in 1963, and it hasn't changed. And so that, for anybody that cares about numbers, is called Title 25, Section 5, and then Part 8 for us. What they did, though, is back then is they excluded safety standards. So therefore, it's omitted from regulations and basically our authority. Back in the 70s, the state adopted what we call 5 CCR 1003-5, and those are our current swimming pool and mineral bath regulations. What's fun about this is that my understanding is the most current version that was written was in 1993, and then last amended in 1997, 1998-ish. So there's different copies that I've found that have different dates on them. I haven't seen any differences. So whatever it was, they didn't write the date that these went into effect or anything like that. So it's kind of a guess. This is just kind of how organized they were on this. But 1997, I mean, when these were last checked, that was 25 years ago, which is kind of funny to think. So Netflix was founded then. Gas was $1.23 a gallon. And I will say so I've been given this presentation a couple times. And when we've been given this presentation, gas was about $5 a gallon then. So it's a little more of a dramatic difference. At least in Colorado now, it's on the high side of $3 a gallon. And then the other fun thing for the public health side is 25 years ago is when we instituted that you had to show an ID to buy cigarettes, which is just kind of funny to think. It doesn't seem like that was that long ago, but yet I don't smoke. But it seemed like that's just something that would have been around a lot longer. So with the current pool regulations that we have, I would say it was really focused on, again, from the 70s, mostly at addressing pools that are the rectangular, start at 3 feet and at maybe 12-foot depth. And that's all there really was out there. It didn't get into a lot of the new features that are out there: infinity pools, underwater benches, ledges, splash pads. It doesn't get into flotation tanks. It doesn't get into, in our case, a lot of stuff about operations. You can go out there and you can look at the chemical quality, but there's not a lot there. There's not a focus on illness and injury prevention. It was just mostly on construction. So that created a lot of problems for us because the industry has changed. Industry was wanting to go out and do all these new splash pads, do all these new special features at hotels, do all these things to draw people in at rec centers, and our regulations were technically prohibitive of that. The Attorney General for the state also had the interpretation that we couldn't give variances because it's not written in the regulations. So we were, in a sense, told that we were stuck with the regulations that we had. And so our recreational water efforts, we felt that those were lacking and didn't address a whole lot of what we needed. So counties got creative with their workarounds on some of this stuff. So one of my buddies that has been helping me try to get the Model Aquatic Health Code adopted in Colorado, he was with Summit County, which is up in the mountains there. They went with their attorney and they were doing variances first, actually, and then they got a cease and desist letter. And then they went with a new version, which they're calling administrative relief. And they were using the Model Aquatic Health Code then just to show that it wouldn't be injurious, but they couldn't enforce that. In my county, Jefferson County, we were using the Model Aquatic Health Code for things that were not in the current regulations. So like when somebody wanted to come in and design a fancy new pool with an infinity edge and zero slope and underwater ledges and all that, we would say, follow what's in the Model Aquatic Health Code as a recommendation. We can't require it. So if they said, no, I don't want to, we could go back and say, well, you got to follow the regs on that end. But to be lenient and let them do what they wanted to do, we kind of looked the other way and had them follow the Model Aquatic Health Code. And that's what a lot of other health departments were doing. And so it kind of worked because there was some good best practice going into place. And people wanted to do that, because we did say, we're trying to get the Model Aquatic Health Code to come in to get it adopted. So you would probably need to come into compliance down the road if this ever happens. So most of them chose to go that route. So it worked out for us, but it also left it very shaky that if somebody just decided that they didn't want to do any of that, there wasn't a whole lot that we could do. So our efforts, August 2014 was when the first edition of the Model Aquatic Health Code came out, and it wasn't until about June 2015 that we had interest in Colorado. And you can see it was a little less than a year later that our what's called the Colorado Directors of Environmental Health group started taking on efforts to adopt the Model Aquatic Health Code. They started looking into it and they started trying to get this ball rolling, if you will. You'll notice nothing really happened until March of 2019. It's when myself and my buddy Steve formed what's called the Pool Program Managers Group. So the way that Colorado set up is that Directors of Environmental Health group is all the environmental health directors. They have sub-programs. So in Colorado, retail food is our biggest program. And then usually the second biggest program is a water quality program, which is usually on-site wastewater. But the pool programs get rolled into a lot of those programs. So we have two subgroups of that Directors of Environmental Health group. So at the time, I was the chair for the Water Quality Program Managers group for the Directors of Environmental Health. So it was March 2019 that we start this group, if you will, of all the pool program managers, those that had a pool program and wanted to advance adoption of the Model Aquatic Health Code. So we started going in March 2019, April 2019, the State Health Department, which is the Colorado Department of Public Health and Environment, they started leading the movement to adopt the Model Aquatic Health Code by reference. And so I know there's a lot of acronyms here, a lot of agencies involved, and I'll kind of explain how they've all played into some of the mess that has been and the chaos that's been our efforts. But they had to lead the movement to adopt the Model Aquatic Health Code by reference. They are the owners of that regulation, of the state regulation. We had a state stakeholder meeting in July of 2019. And I think for the most part, it went okay, except that we had one hiccup there. And I'll get into that here in a second. November 2020 is when the Model Aquatic Health Code it was presented to the State Board of Health and adopted by reference. And so August 13th, 2021, we had to, one of the requirements from the State Board of Health was that we had to create an implementation policy. And so that's when that got adopted. And then we started revising the regulations and coming up with what we wanted. And it wasn't till, well, I should say January 1st, 2022, there was a group of us who were working on this. We learned that the city and county of Pueblo adopted MAHC-based regulations on their own. And we weren't aware of that was going on. So they were actually the first to go ahead and get a regulation. But 2023, when I signed on to do this presentation, we were ready for distribution to what we call the local public health agencies for comment. And then CDPHE wanted to get involved again with this project, and that kind of put things on hold. And then 2024, we're hoping for local adoption. So that's a little bit of the efforts that we've had. And timeline seems a little bit confusing, but I'm going to go into hopefully a little more details as to why it's almost taken 10 years for us to get the Model Aquatic Health Code basically adopted into our regulations. So looking through all of the work that we were doing for the last 10 years, I'm going to say there was 4 hurdles along the way, or 4 categories of hurdles along the way that created some issues with us. First being legal, we had legal issues. There's resource issues. We had a lot of opposition that we had to kind of overcome, not just from outside, but also from inside. And then decision making on that. And it was that was probably our biggest hurdle, overcoming that. So first, for legal, the way that the statute was written was that any city, town, or city and county may by ordinance regulate swimming areas. So this is where it goes back to the state health department is not going to regulate and create a mandatory pool inspection program like they do with food, like they do with our child care programs. It's a voluntary program. So that's where that comes in. At the same time, it said that the Department of Public Health and Environment may adopt any rules and regulations necessary for the proper administration. So the way that this has been interpreted for several decades was the state had to create rules and regulations, and they created the one rule and regulation for the state, and then the city and county local public health agency may adopt those regulations if they wanted to. So where that created the issues for us and why counties couldn't just do it is because the way that it was written was counties or local public health agencies were not authorized to adopt their own ordinances. So it's a city, a town, or a city and county. And in the state of Colorado, we only have 3 city and counties, public health departments. So Broomfield, Denver, and Pueblo. And at the time, Denver was, their home rules, they're kind of under, could actually go forth and adopt their own rules and regulations. But the rest of us had to wait for the state. And the state, being not a mandatory program, didn't have a high priority for this and didn't want to really be part of creating regulations. So that goes back to why the state health department, that CDPHE, was not involved, and then involved, and not involved, and then involved again. The other issue that we have, like I mentioned earlier, we had omissions from the statutes, and then on the safety side of things. So that still is not in statute. It's still not going to be in our regulations. So it's just something that we will have to have until they actually have enough political will to create a revision of that statute, state statute. So 2018, I believe it was, is when we started getting a different interpretation from the Attorney General that if the state wanted to create regulations that allows the counties to, or local public health agencies to adopt regulations, they could. So that kind of got us over that legal hurdle and kind of got us moving forward to being able to adopt the Model Aquatic Health Code. Like I said, the lessons learned. So if I were to go back and do this again, our way of getting around things was the administrative reliefs, and then following the recommendations. But really what we needed, and this is what happened, was the state pool regulation was finally revised. So the whole regulation itself wasn't changed. The only piece that was changed was one sentence basically, or one section. And it just basically clarified that a city, a town, a city and county, or a county or a district board of public health now may choose to adopt the Model Aquatic Health Code, whole or in part, into its local ordinances and rules. So, and then again, it said that we would be the enforcement agencies of that. So this is what we needed basically to clarify that we can go ahead and adopt the regulations and do it ourselves. And of the regulations, it's a Model Aquatic Health Code. Next hurdle we had was resources. So if you saw that between 2016 and 2019, that there was a hiatus. It wasn't a whole lot of work that went on until it was kind of the mid-level managers, if you will, that took on the efforts of adopting the Model Aquatic Health Code from the director's level. So in those 3 years, though, what has happened is other regulations were of focus. So the FDA food code was adopted in Colorado. We had our own food code for the longest time, and then they switched over. So lots of efforts, again, with food being the biggest program, went to the adoption of the food code. The state also has what we call Regulation 43, and so that was created in 2013, and then again revised in 2017. So kind of in that time frame, and that was a big shift. So the way that worked is, again, Colorado statute said that here's the very bare minimum. And I think it's like only 5 things that Colorado has to do for on-site wastewater. And then one of them is, the state must create its own regulations. So that's what Regulation 43 is, the state regulation. And then once the state regulations have been adopted, each county has 1 year to adopt their version of the reg. So they can basically adopt the same thing or they need to adopt some version of Reg 43. We also have childcare program, and their regulations were under revision at that same time. So pretty much, like I said, pool programs, inspections and regulations were not a high priority. We had lots of natural disasters during those times. We have lots of fires and we had lots of floods going on, and we had some of our biggest fires and floods during those years. 2020, we had a pretty big pandemic that happened, and that drew a lot of resources away from people. And if it didn't draw resources from people, it also saw a loss of workforce experience, I should say. So people that may have been in pool programs that had to work on the pandemic response for local public health agencies here, they got burned out and they quit. So not only did they just lose people, but they also lost a lot of the experience. And so anything that was with pools, went out the door with them as well. And then LPHA involvement. So as I kind of mentioned before, it was a pool program managers group. What we were a collective of those that have pool programs or are interested in a pool program. And so, if you will, we were the cooks, and we did not have a chef. Basically, we did not have the state health department with us involved with this. So we had too many cooks in the kitchen, if you will. We had lots. I think we had maybe about a dozen different agencies that were involved with it, and each agency has their own opinion, the way that they were doing things, their own politics on how, and so all that played into how they thought that the regulation should have been written. So that was one of the big things. And then the other thing is, with that, because there was not a dedicated person or group of people really to basically to keep the ball rolling, to keep the momentum. It was all voluntary. That made it really hard to dedicate resources and time to get a lot of movement on the regulation adoptions. So the lessons learned for that was the resources. I mean, that's really the only thing that we could do. And it comes down to planning and determining priorities. And so what we tried to do is we tried to meet routinely and set those into, this is when we're going to do this. This is what we're going to accomplish each time. And we understand that the people had different priorities, within their departments and when they can come and go. But if we could keep a core group of people moving along on that and keep that as a priority, then that get some momentum going on that. So if you could see, we had a hard time though keeping that MAC adoption as a priority for everybody. Again, as a voluntary program. Fortunately, we were lucky that there was enough people that had a strong enough desire because they had a big enough pool programs, that they wanted to see the Model Aquatic Health Code adopted into their regulations. The other part about this is determining the priorities and planning is we really identified the why. What was our purpose? Why did we really want this Model Aquatic Health Code? And I think what really also helped is the fact that so many of us were so frustrated with our current regulations that that's where the desire came from. And that's what helped move things up a little bit more on the priorities list. So I mentioned that Pueblo went ahead, and before we were able to get our regulations out for draft for the group to review, they had adopted their own version. And so they did have 2 or 3 people that were dedicated. And I think that's all they did for a couple months was just work on their pool regulations, getting their pool program set up to adjust for the new regulations, do the outreach, do the change in all the forums and everything. And so they became the leaders on the side there and sped ahead of everybody. And so they had the staff and the priority and the resources. That's why they were able to move forward so fast. The third hurdle was opposition. So stakeholder input. As I mentioned in July, the state health department had a stakeholder meeting, and we had people from the industry, we had operators, the pool operators, but we also had, and I'm going to call them out by name, but the ICC and representative from the Pool Hot Tub Alliance, PHTA, ICC being International Code Council, who oversees a lot of the building building codes. And what happened was we had one individual that was affiliated with them. I don't think they were necessarily from those agencies, but he got on and had a very hostile and I'm going to say false diatribe about the Model Aquatic Health Code. Again, my understanding was he's not speaking for those agencies, but he had a very strong opinion of the Model Aquatic Health Code and said a lot of false things. So that's where there was a push from the ICC and the Pool Hot Tub Alliance to not adopt the Model Aquatic Health Code as our base code because they wanted their codes adopted. And so ICC has what's called the International Swimming Pool and Spa Code. And that's what they felt should have been the construction code piece. And so that's where we had the opposition from the stakeholders, was that's what they wanted. The industry, we didn't get a whole lot of opposition there. We haven't heard a whole lot of, we can't afford this, we don't want any new regulations. A lot of them, I've heard actually the opposite and said we want them. But the biggest thing that they've said is we want them to be consistent. And so that was one of the driving purposes of the pool program managers group and why the group, the or so of us came together to create one regulation, and so that we can try to be consistent as possible. And then, like I mentioned, Colorado has, I think about 53 different local public health agencies with a varying spectrum of involvement in the pool program, meaning that, people that didn't have a pool program, they didn't want some new Model Aquatic Health Code that's going to be lots and lots of pages coming in and forcing them to have to do some pool inspections or something like that when they don't have the resources themselves for that. So in a sense, we had some opposition from the regulators and from our own groups that didn't want the regs change. And then we have people that, again, with the pool programs that varied from complaint basis only all the way up to full programs of inspections and plan reviews. So again, everybody trying to agree upon what level of regulatory authority should we have. So the lessons learned there, with the stakeholder feedback, I mean, we're going to have it. It's one of those things that you need to hear the community. You need to outreach them, let them be aware, get their input, their thoughts. I will say for the couple counties that have gone forth and had stakeholder meetings with their local, I guess, stakeholders, they haven't had a lot of pushback and they haven't had a lot of negative feedback. Again, there was some concern for some things, but it wasn't like what we saw with the state health department. They did have some pushback, but it wasn't, again, nearly severe, and the local counties were able to address that fairly well. At that stakeholder meeting, we were fortunate that we had Doug Sackett from the CMAHC there, or was with the CMAHC then. So he was able to speak up and try to speak truth to the claims of this one person about the CMAHC, the Model Aquatic Health Code. So having somebody from the CMAHC was really great for us, and I think they're more than happy to be of assistance for those that are interested in looking to adopt the Model Aquatic Health Code. If you're going for its entirety, I think if you're going for it in pieces, it's one of those things you don't get as much pushback. And then the other thing that we had to do is we had to unify the regulators. And so I had mentioned that the State Board of Health wanted us to put together that implementation policy. I mean, that was the sole purpose of that policy, was to address the external stakeholders that wanted the say in how the regs would be implemented, and also for the regulators. And again, that was the purpose and the goal of our group coming out with one regulation. So I mentioned Regulation 43, the on-site wastewater septic system regulations. Those aren't based off of a code or anything. Those are written for Colorado. And so the counties then have the year to adopt it. So we use that as our model for our regulations, and to create one base draft, and then the counties that are interested in a pool regulation update with Model Aquatic Health Code incorporated into it would adopt that regulation. The other thing we had was hurdles along the way, or the last hurdle along the way was decision making. So had no clear guidance when we first started this. We just got we want to get the Model Aquatic Health Code adopted. And so we were working on everybody having their own kind of direction, their own way of wanting to do that. We didn't have that state support because of the way that we're structured in Colorado, where you have the state health department. And then underneath that, we have all of the local health departments. And then we also had different levels of involvement. So like I mentioned, all the different types of pool programs. But the one actually I think was kind of funny in a way, and it's one of the bigger ones, but we had a lot of squabbling, if you may, over the format. So the way that our current regulations are written is kind of in a paragraph form, whereas if you're familiar with the Model Aquatic Health Code, it's broken out. And so like basically every little thing has its own citation to it. And there was a lot of back and forth and discussion about what format to keep. And so in the end, Pueblo went with the adoption of the Model Aquatic Health Code. It looks like the food code, and it's laid out in citations for basically every little thing. The group that was working on the regulation, they voted to actually keep it like the Colorado regulations, because that's what people were most familiar with. And so it was where we kind of got bogged down ourselves, was we had our regulations, and then we're trying to insert the MAHC into different spots into those regulations, and it didn't always line up. And then it got confusing of where the Model Aquatic Health Code items should have been inserted. And so that also led to a lot of discussion and a lot of back and forth. And so that's what also made it difficult in the drafting of the regulations. The lesson learned on that was we needed clear leadership. We were looking for basically the state to lead us on that because of the way that the hierarchy is in Colorado. We would have liked the state to have taken ownership. State for the longest time said it's a voluntary program. We are not going to be involved with any enforcement. We're not going to basically require any county to do a pool program. They relented when they were basically had the discussion from the directors group, and we wanted to get the ball rolling. And they said, okay, we have time now that we're done working on all these other regulations. We wanted to revise first, that they would work on getting the Model Aquatic Health Code and the regulation changed so that the counties can adopt their own. So that's where we had their involvement. And then we had common regulations. So again, creating that base regulation, creating that framework for the counties to then go and adopt. So we were just basically trying to create, this is the bare minimum that each county will have. The counties that want to adopt something can add a little bit more to it, but we're trying to get a happy medium where we're all fairly consistent, because we've got corporate gyms, for example, that have pools and spas. They can be in one county and then across the street be in another county. And it's just crazy that you would have two separate sets of regulations or requirements. So we were trying to avoid that as much as possible. So the one thing I will say back to the clear leadership, what has happened and why I kind of mentioned earlier that CDPHE, or the State Health Department, was not involved because they didn't want to be involved. They said this was not a mandatory program, wasn't something we're going to require, or something we just don't have the resources and time to do. And then they got involved to get the regulations adopted. They got the regulations adopted, said, all right, now it's up to you all, the locals, to adopt your own set of regulations and come up with something. Well, earlier this year, the State Health Department said, hey, we're kind of interested. What are you working on? Where are you with these pool regulations? And so basically we were ready to have a draft out to the local public health agency that are working on this. We had our ready to go for everybody to take a look at and adopt. And the state came in and said, well, hold on, we want to see what you're doing before you put this out as a regulation that everybody in the state is going to follow. So we put ours on hold. The state got involved again. And then they said, we want to get caught up. Where have you done? What all the efforts have you done? And where are you with this process? What do we need to know? And so we spent the first part of the year filling them in, getting them caught up. And I'm going to say about mid-year, we learned from them that they had gone ahead and taken what we worked on and said, oh, we're going to do our own regulations for the state. And so that's where we've left off with them. And now we're waiting for them to get us a version of the regulation. So it's one of those things that's a little bit, again, this is just my personal opinion at this part now, it's a little bit bittersweet because we've been wanting that direction and that guidance this whole time and weren't getting it. But then they came in at the 11th hour and took over. And so after the 5 years of us working on it, they said, okay, we're going to do it now. So that was, we've got the clear leadership. And so that's where I guess I have to come clean and admit that we still, after all this work, do not have a pool regulation adopted that is based on the Model Aquatic Health Code at the state level. Some other things that we have for consideration, if you are looking to adopt the Model Aquatic Health Code, I know in the Model Aquatic Health Code that there are some items where they give you a bit of a timeline, so a 1-year enforcement timeline, but that was one of the things that we needed to look at. How long do we want to allow for people to comply? Because there may be some things that, well, basically everybody wants to know, am I grandfathered in? And so what are those things that you want to grandfather in? What are the things that you won't tolerate? And so those are the things that aren't really laid out and we haven't gotten to at the discussion at the state level yet. The documentation for us in Colorado is going to change. Again, every county has their own pool program, has their own different set of documentation. So for plan reviews, there's a different application. For their inspection reports, it's a different type of form. And so one of the things that we would like to do, and we haven't gotten to this level yet as well, is once we get the regulations adopted, having a consistent documentation database, if you will, or template. So it doesn't matter what county you're in, your inspection form should look the same. This is the way that it's done for the other mandatory programs with the state. So like our retail food program inspections, they're all done that way. So it just seems silly. Why are we still at this level of the individual counties having their own set? of documentation. Training. When we adopted the food code, we spent a year training and getting to know the differences and learning it. So our current pool regulations, they are about, if I remember correctly, they're about 30 some pages. We're about to go to 100 some page or a couple 100-page regulation. That's pretty overwhelming for a lot of people, staff, operators, and whatnot, to look at, this is what you're going to make me understand now. So we have a lot of training that we have to do with staff and with the operators and getting them to understand what are the expectations. The other thing that we have in the current pool regulation that is not in the Model Aquatic Health Code that would need to be considered, but we have a lot of hot springs and natural swimming areas. And so they present their own challenge. So the Model Aquatic Health Code is, my understanding, for a closed system, meaning it's recirculated water, it's got the pump. We have hot springs and this water is not full of minerals. It's not a high hardness, stuff like that, or it's a smaller body of water that's more manageable. So with hot springs, the way that we have them out here, there's some that are pools and they use a spring that is fed into the pool system. Those are a lot of fun because you can't maintain any disinfectant due to the high amount of minerals and everything else that's in the water. It makes it very hard to measure. It makes it hard to keep the equipment maintained without the buildup of calcium and all of that, and the hardness and the minerals. And then we have natural swimming areas. And actually, those that have a swimming pool program do not regulate natural swimming areas. So that's one discussion that we've had, is whether or not that needs to be in regulation. However, if we take it out of regulations, there wouldn't be one for natural swimming areas. And it's one of those things where in Colorado, we are starting to focus on the harmful algal blooms. Our waters are warming up enough that we're starting to see that as an issue. Luckily, we're not seeing a lot of like Maglaria fowleri, and we don't have the Vibrio. So some of those warm water, natural, like open water type diseases and illnesses. So that is a concern that it could be coming, but I've learned from other states that have, I think they call them plakes, the play lakes, or those large open water areas. You can't do anything about algae. You can't do a whole lot about disinfectant because it's just not feasible. It's not possible. So having to consider, how are we going to keep bathers, swimmers safe in those types of waters, and keeping, addressing the regulations to fit those scenarios. So, like I said, a lot of work has been going into trying to get this Model Aquatic Health Code, a lot of collaboration. And so with that, that's, we're still not there. We're almost there. I'd like to get us all the way there. Hopefully in 2024, we will have done that. But, I mentioned there's a lot of people that have helped get us to where we are. And so I do want to recognize those people. So I said, my partner in crime has been Steve from Summit County. I mentioned earlier that city and county of Denver, they were able to get their own regulations in place, separate of the state regulations, because of the way that they're set up. So Denver and county, I want to thank them because we were basically able to copy from them. So we started with the draft that they had, and that's what we started working with. But then Autumn, Megan, and Scott from the city and county of Pueblo, they were very instrumental when they went off and did their own thing. So Denver has been very instrumental in getting one version of the regs set up, and then Pueblo was the other version. So they've both been very, very willing to help us and share. And then we were reaching out for other counties that have adopted the Model Aquatic Health Code whole. The two that I've connected with were from New Mexico. I understand that I think in Missouri, Kansas City, you've also adopted the Model Aquatic Health Code in full. I didn't know that, but there's other people as well that have done this, and so I think if you're looking to do anything like this, it'd be nice if you can learn who has also gone through this process. So, not just Jefferson County or state of Colorado, but there's other places too that could probably help you. And are willing, again, Levi and Eugene were very, very willing to help and guide us. And then also just wanted to give our directors of environmental health and the pool program managers, all of those involved with that, a shout out. So thank you all for your assistance in getting our efforts towards a model aquatic health code adopted into our regulations. I do want to give a shout out and a plug for Pueblo County. So they had a grant, and it was through NACCHO, I do believe. So they created a toolkit for adopting the Model Aquatic Health Code. And so I have the website here, but if you go to the NACCHO's website, you can find that toolkit as well. And so if you're looking to adopt the Model Aquatic Health Code, I would highly recommend that you look at their efforts. So that's all I've got. This is my contact information. I'm more than happy to answer questions, be a resource. Like I said, I have to just put the disclaimer out there. We haven't gotten there an adoption yet. So I would just say I'm just kind of like the poster boy for the state of Colorado. It's not just me and being the expert, if you will, on this. I just like presenting, and I'm more than happy to talk about all of our efforts, but I got the connections with a lot of people and so we could probably get you an answer if you've got questions.
Great. Thank you, Mitch. If you have any questions, please put them in chat and we will go through those as they come in. Mitch, I just wanted to pause and take a moment to thank you and Autumn and the rest of the team in Colorado for the efforts you're doing in MAC adoption. And I don't want to use the word fighting the battle, right? Fighting the good fight. That's a better way to put it. You definitely have been a leader and an inspiration to others. And thank you to Autumn for y'all's willingness to go around and have these conversations in multiple formats. It's been very, very beneficial. I've got a couple of follow-up questions for you. And you've touched on them throughout the presentation, right? But what's been the stakeholder reaction, right, to MAC adoption from what you've seen so far?
So with the counties that have gone forward with the stakeholder, at the state level, the one that we had back in 2019, I believe, it was actually pretty positive, except for that one interaction. And then the city and county of Denver had also gone through a stakeholder process, and they had a fairly positive interaction as well. And same with city and county of Pueblo. That's what they've also reported, that they did not have a reaction, I should say, or opposition as strong as they did that one time. So we all kind of went in like ready to kind of like, all right, here we go. We're going to have to do this with them. And it wasn't the case. It was actually way more civil, if you will. I think one of the things is they were much more on the same page with us as we had more discussions about how we were going to do the implementation, that they weren't just being completely left out of the process. And I guess I would say, one of the biggest things of their feedback was, the differing codes. So you've got somebody that's wanting to build a pool, you've got the Model Aquatic Health Code, the construction section, you've got the ISPSC, you've got the building department, you've got the fire code, which one takes precedence? So in that implement policy and in our regulation, it did get written in there that the more stringent would be the one that takes precedence. However, it gets hard because of what is the more stringent. So fire code may have one thing, ADA has a code, and so I guess I should say the one that's been the holdup still for us, and we have resolution on is like the which way the doors open. The Model Aquatic Health Code says one way, fire code says the other way, ADA says it's got to be like this. The handles have to be a certain height and stuff like that. So who is really the more stringent? And so we've left that up to the local building departments to help us through with that. But for the most part, the biggest thing was, hey, again, we just want you all to be fairly consistent. We don't want 64 different versions of a regulation or, different types of enforcement of a regulation. So we're all somewhat on the same page, and that's been our main focus, is trying to be consistent.
Excellent. Excellent. Very glad to hear that overall, the response was much more favorable than what you expected. It's always a pleasant thing to have.
It is, yeah.
Yeah, yeah. What you gave the audience today a lot of tips to and a lot of information about how you went through the adoption. Just kind of making it a little bit less presentation, a little bit more personal, right? When you're speaking with another health officials, we have several on the meeting today, the webinar today. What would be your kind of like top 5 personal tips towards pursuing adoption in their jurisdiction?
That's a good
And it doesn't
question.
have to be 5, just just what are your top tips?
Yeah. I think for us, the biggest part was the guidance and the decision making. So again, we were trying to do this as a committee. And so at first we started off with about a dozen health departments. And at one point we kind of cut everybody out. It was a bit of a jerk move, but we whittled it down to maybe, I think, 4 of us to really get things moving along because we just had too many people wanting to share their opinion. And so again, if you can get the leadership, that guidance from the start, this is the format, this is how we're going to do this, this is what the base regulation is going to be. So our goal was to kind of really set up the straw man draft. Basically, here's what we should be the minimum, and then we're going to take it back to the rest of the group and they can say, yep, we agree with you, this is the minimum, and then we can have a little bit of back and forth there. But we started right out the gates, the back and forth, so we spent a lot of time just debating which definitions should have been in our regulation, so things like that. And if we can kind of whittle out the I shouldn't say whittle that sounds wrong. If we can get that guidance and that leadership to say, you know what, this is how we're going, this is what we want, here's the base. We left in some things, again, using inspiration from another set of regulations. They have what were called opt-in, opt-out versions. So flotation tanks, that is something that not every county wanted to enforce or regulate. We only had like maybe 1 or 2 counties that wanted to do that. And so we left that as an opt-in. So if you're going to have regulations for flotation tanks, here's what we're going to say, you adopt. And so not every county may have it, but at least, if anybody that has flotation tanks wants to do it, this is what they would have followed. And so the guidance, the format, all of that, if that was kind of just provided to everybody from one level. So in my opinion, the state level would have been, here's the regulations that we wanted the state or everybody to follow within the state to be consistent. That would have been a lot quicker. That would have been kind of that clear direction, that clear guidance, and we would have spent a lot less time discussing and trying to have everybody's political, personal, and programmatic influences.
Great, thank you so much, Mitch. We're looking forward to seeing as y'all go through and further implement the MAC and get a couple of years under your belt. We're looking forward to seeing data that you might have on violations and closures and how it's impacted overall health and healthy swimming in the area in Colorado. So just kind of putting a little bug in your ear. We're going to be approaching you for that data in a couple of years.
Yeah,
So,
and actually, I can put another plug in for Pueblo again, because they've done this. They did it with the grant, so they did do that. They did find that their violation rates did increase quite a bit because it's just a shift, and they're working on that. But they really worked hard with their, and I believe they're back down to kind of. They are now below the national average for the types of violations and the frequencies that they're seeing them. So yes, they had a spike at first, but then they worked really hard to get people in compliance, and they're starting to see better compliance with their pool operators. They did do, so like I said, they were under a grant. They've done a lot of the work, and even though I'm with Jeffco and work with the state, I still want to really promote a lot of the efforts they did. And I believe NACCHO, or maybe even NEHA would have their presentation or their data, but we've been seeing a lot of good positive trends come out of Pueblo for I think the year or so of data that they have.
Excellent. That is definitely good news.
Yes.
Definitely good news. Well, folks, we are coming up on the hour. I want to thank you all for your time. A special big thanks for Mitch, not only for this presentation, but Mitch has been all over the place. And I want to give a shout out to Autumn too, all over the place in the conference circuit, talking about their experiences and sharing this presentation. So thank you for your efforts, not only today in this presentation, but also in general over the last year or so and years in promoting and working towards adoption and sharing your experience with others to where they have a roadmap towards adoption. So again, massive, massive thank you for that.
Well, thank you.
For all attending, please be on the lookout for our upcoming webinar series next year. We are working on the presentations. We have some really, really good speakers and really good topics we'll be covering. So please check with your CMAC Connect email and other sources as we advertise those as they come up. From our CMAC family to yours, we want to wish you a very happy holidays filled with peace and joy. And we look forward to seeing everyone next year. And as we kind of round out this year of thankfulness and this time of season of thankfulness, we want to extend a big thank you to our public health officials, right? It's very important that that we acknowledge the work that you do and the efforts you put in to keep people safe, not only for swimming, right, but for food and tattoo exposures and sanitary waste. And you truly are the unsung heroes of our country. And without you, we would be in a much, much worse situation. So thank you for your efforts in the prior year. And thank you to our health officials for your efforts in the years to come. And with that being said, we'll see y'all in the new year. Thanks again, Mitch, and thanks for everybody for attending.
Welcome. Thank you, Dewey. Thank you, Susan, for all your help and everybody. And thanks a lot for your time. You all have a great one.